I'd like to welcome you to the Wednesday, May 20th press conference for the Unified Command. I'm Merceria Ludwig with the Mobile County Commission, and with me are the Unified Command principals, Mayor Sandy Stimson, and Dr. Bert Eichhold, Mobile County Health Officer. We're happy to entertain your questions.
We will first have questions from WALA.
Yes, I want to make sure that you can hear me. Dr. Eichhold, we've been monitoring the Montgomery situation. It's been about 12 days since Governor Ivey issued her safer at home order. I think you said it would take about 5 to 10 days to see a possible bump in cases. Have we seen that, and can we attribute any increases to the relaxation of restrictions?
I really do not know a lot about the Montgomery situation except they're on medical diversion at this time. They have consumed all their hospital intensive care unit bed capacity, and I don't know whether it's attributable to the elective surgery or exactly what's going on in in Montgomery.
But I did want to ask you, you said it would take about... Yeah, you said it would take about 5 to 10 days to see a possible bump in cases. This is the second part of it. Have we seen that yet, or do you think?
Today,
Keep on.
Today we actually are looking at the numbers for Mobile County. We have not seen a bump in the numbers for Mobile County. 5.1 is what the American Journal of Medicine says is the incubation period for it. It could be as many as 12 days for people to actually make presentations of symptoms, but we have not seen an increase in disease activity as attributable to any changes that the governor's made.
And I think I have at least one more question. I think this is with Dr. Eichhold, too. There was a study from South Korea that suggested people who test positive a second time aren't contagious. What are your thoughts on the potential for reinfection and how that might inform decisions about lifting restrictions?
I think that's an interesting study in Korea. To my knowledge, they have not been able to culture the virus to be active live virus. So is this dead virus that is having the chemical reaction and showing that there's disease, or did they ever no longer have the virus present? So we know people can actually carry the virus for up to 40 days. And so I think there's still a lot to look at. And this would be something that we have concern about, but I think Bert's opinion and that I can determine is if you've recovered from the disease at the present time, you will have some form of immunity, but that will be looked at by the National Institute of Health.
Do you have any more questions, Steve?
Yeah, I just had one follow-up for Mayor Simpson. This is the last one. What kind of a reading are you getting, if any, Mr. Mayor, about whether the governor will renew the safer at home order or relax it further, and maybe what would you like to see at this point?
So the reading I have is that obviously she's going to make an announcement, but I don't know really all the issues that she may address. I'm not privy to that. And so I'm hopeful that she will be cautious as she continues to open up the state, but I think that she will be.
Thank you.
Thank you, WALA. The next set of questions will come from AL.com. Please announce who you are.
We don't have any questions today, thanks. We're just Steve asked all mine. Thanks, Steve.
Now we have WKRG.
Hey there, everyone. We have a few questions. The first one, I believe, is for Dr. Eichhold. We've got a question. Should people be concerned about getting coronavirus from takeout food? And in that, how do people know that the person preparing their food doesn't have coronavirus?
That's a very good question. We work very closely with all food establishments. Hot food that's been recently prepared and cooked should not be contain any coronavirus because of the food preparation. Other is that the employees should be wearing gloves as they're preparing their food so that their personal contact will not be transferred. But to be safe, you can always wipe down, if you're doing takeout, wipe down the containers just like when you get items from the grocery store externally and use caution. There are really no guarantees with COVID-19. We can't see it, and we just have to exercise caution.
My next question, in times past, this kind of is for anyone who'd like to answer it, the governor's kind of given us about a week prior to the changes taking effect to give a little bit of notice so that there's been at least a couple of days in between for people to understand what the switch will be. Do you think with the announcement not being made yet and the safer at home order ending on Friday that we're being given enough time, or people are being given enough time to understand the changes?
I'm not sure how to really speculate on that because we don't know what she's going to say, so we really don't know how much time we need to implement. But those people, the companies or entities that have not opened up, I can assure you they have a plan. But if it's somewhat like the restaurants that needed to buy food, obviously it does take a few days. But regardless of what she says, if it continues to relax restrictions, I think that people will receive it just as she intends it.
And then my last question, do any of y'all think that there will be a new standard of care or a new standard of cleanliness moving forward?
I would say is I think, yes, I think everyone in our community is more concerned about cleanliness. I know that your health department, when we do food and lodging inspections, we are going to look closer at the hygiene conditions and just try to encourage everybody to use best practices that they can. I don't think there's anybody in the retailing business that has any desire to see their customers not have a good experience. So we will keep teaching and educating and working with all the industries that we have regulatory authority over. And I think they are very receptive, and they're way ahead of us in figuring out what are their best management practices.
Thank you.
Thank you, Dana. Thank you, Dana. Next up is the Lang app. We will come back to the Lang app. The next one up is WPMI.
Good afternoon. I guess I have follow-ups to some of the other questions that have been asked. Dr. Eichhold, in terms of the Montgomery situation, have there been at any point any diversions here in Mobile? Have we ever reached capacity in the COVID units here?
No, the question is, have we ever exceeded hospital capacity in Mobile, Alabama in regards to COVID-19? We have not. The community has responded in a very positive manner. The hospitals and their leadership have all worked very hard. So we've never had a situation in Mobile in any of our hospitals where the demand for medical services has exceeded the capacity to provide them in intensive care units, ventilators. There have been some delays in the emergency rooms because of number of patients, but capacity has been exceeded by demand.
Looking at the cases beginning in May, the 14-day totals for cases, since May, beginning of May, they've averaged about 500 cases in that 14-day. Are we to a point, is that stabilized? Are we to a point where we can relax the orders?
Question is, are we at a point in time where we can relax the order? We're going to comply with the governor's instructions. The case numbers, we're increasing the testing numbers of patients every day, and the number of new cases is relatively flat or slightly declining. We are optimistic that we're going in the right direction, but we need everybody to still be cautious. We are not looking for any increases in COVID-19 cases. This is a preventable disease, and so I think we are heading in the right direction. Are we there yet? We, as Commissioner said, until we have a vaccine, this is not over with.
Mayor Stimpson spoke about Governor Ivey's order, not knowing what she's going to do. I guess this would be for all three of you. Have you had any conversations with the governor or Dr. Harris about what your desires or wants would be for the new order?
I have not had any conversations.
Bert Eichhold here. I've had conversations, but not specifically regarding the order. We talk on a fairly regular basis about COVID-19, and I would anticipate there will be some issues addressed about daycare facilities, but I do not know what that will entail. But I think that is going to be something that is on the agenda to be looked at. Whether this is the time for that subject matter to be addressed, I do not know.
One of the choices was myself.
And I think this is my last one. Mayor Stimpson, yesterday the council adopted your order allowing sidewalk and parking lot dining. Restaurants just have to apply. How many have applied? How's that going? How's that working?
My understanding is that the applications are being done through Bill Mobile, and I've not visited with them this morning to find out if they've actually had any. But I know that we're setting things up so that we can accept those applications, but I just don't have an update on it.
Thank you.
They were going to ask you guys.
The questions have been, we've ended with the questions. Now, if the principals have any final comments.
Well, I'd just like to really thank those retail establishments that have been so diligent in trying to honor that 6-foot distancing with signage within the stores, little blue feet on the floors, whatever they've done. But I'd also like to encourage the public to also respect those employees in those retail establishments by wearing your face covering. There seems to be, some people just seem to really resist that. But it's pretty painless. And if you just do it when you're going in and having to deal one-on-one in a retail establishment, it is just so helpful. It protects you and it protects the people in the establishment. And I know that a lot of churches, houses of worship right now are contemplating reopening. There is guidance available on how to do that safely. And I would suggest that you go to the Mobile County Health Department website. There's information on the City of Mobile website, the Mobile County Commission website, the Alabama Department of Public Health guidance there. There's one critical piece that I'd just like to highlight for you, and that is to make sure that you have adequate sanitation supplies. It's all right to open and you only have a handful of people there, but however many you there, you also have to have what you need to have your supplies there so you can wipe it down afterwards, so that you have hand sanitizer, all of that. And that is at a premium now. It is not easy to find right now. So as you consider whether or not it's time for you to reopen, check your pantry, your cupboard, and see whether you have the antibacterial cleaning supplies that you need to be able to do it safely for your congregations.
Bert.
I would just like to thank the hospitals, the medical facilities, the employees of the healthcare industry. and especially my colleagues, doctors who are providers of healthcare. These are challenging times. These are very important human lives that are being impacted. We need to all be careful. We need to go back and get our regular medical treatments that we put off as we move forward. And again, immunizations of children is extremely important. And those who have had significant economic hardships, thank you. I think we're all going to do okay. It's going to take a little time. This virus is not like a tropical storm. The electricity is back on, and life is back to any semblance of normal. This is going to be the new normal for a period of time, but we will do well. We will be a strong and healthy community, and we really need to have acts of human kindness to each other. Help your friends, help your neighbors, wear your mask, keep your hands clean, and be conscious of the lives of others.
I'll conclude by saying that as I look back over the last 2 weeks and think about what has occurred and where we're focused right now, is that we realize that our nursing homes, our public housing facilities and all, have been hit especially hard. I believe that there are some that within the nursing home facilities that have, to my knowledge, I think that they've had almost no cases. And so a real compliment to the management of those nursing homes to have managed them in such a way to have had that kind of outcome, or at least a very low positive rate. So it just does show you that by good management practices that we can make a difference in the spread of this disease. And that would extrapolate to we can, as individuals, make a difference in how this disease is spread. And the sooner we take that personal responsibility, the quicker that we'll be able to go back to some sense of normalcy, which I think that we're really approaching right now. And I'm really anticipate what will happen over the next 2 weeks. I mean, I think that the last 5 or 6 days, what we've seen with the results, with increasing amount of tests, but not with a whole lot of increase in the number of cases, if that continues on, that could show that we're definitely headed in the right direction. And I think that we'll somewhat at that time maybe breathe a sigh of relief, but we won't know that for a couple of weeks.